My name is Peter Davison. I come from the UK originally, but I live now in Germany, mostly in southwestern Germany.
My name is Pamela. I came from Croatia in a little place is named Pula.
My name is Melanie Funk and I come from Australia.
I have a brain tumour. I have known for 18 years that I have this brain tumour. I got surgery on it first in 2005 and then again in 2016. I think for the first 11 years I didn't take the brain tumour super seriously. But when it came back, I was forced to take it seriously. At about the time that I was recovering from my surgery in Freiburg, a self-help group was established for patients with brain tumours, and I joined the self-help group. I quickly found that brain tumour surgery deprives a lot of people of a lot of their self-confidence. Through the self-help group in Freiburg, I took up contact with the National Brain Tumour Support Charity in Germany, the Deutsche Hirntumorhilfe, and ended up doing quite a lot of work for the Hirntumorhilfe in Germany.
I'm wrong because I diagnosis of the brain tumor 5 years ago, and 3 months later I have a seizure, epileptic seizure, and my Croatian Association for Epilepsy tell me about EUPATI platform, and I want to learn something about it and feel like that can I bring some knowledge to other who have epilepsy.
My main motivation to enroll in this patient expert training program was really to gain the skills, to gain the knowledge, but most of all to gain that confidence to be able to make a really big impact for patient advocacy, particularly in Australia, but wider as well where possible.
I've been on this program for whatever it is, 16 months, however long this program has been running. Yesterday, for the first time, I met all the other human beings that were also involved. And, you know, I've been in video conference conversations with some of them. I recognized a few faces, a lot of names, but finally they're actually human beings associated with it as well.
Everything. Knowledge, the people who work in a EUPATI platform, the people who I met, and conversation between two of us, and everything. It's beautiful time to spend with you.
My favourite aspect of this program so far has just been really that collaborating with so many different people from so many different corners of Europe and the globe. It's been an amazing privilege to be able to hear other people's stories and to hear their perspective on things as well.
The surprise actually hit me not at this session, which we're doing in person, but when we had the online version of this, whenever it was, March this year, I guess, the degree of expertise, confidence, commitment, the variety of experience out there, and the extent to which dozens of these people, my fellow cohort members, were able to influence conditions in their country. I found that really, really inspiring. Continue to find it really, really inspiring.
The knowledge at first, and everything that I heard here I didn't know, and I want that knowledge bring in the Croatia and help people with epilepsy. And first of all, my wish is that in Croatia we have a EUPATI platform.
What surprised me most has actually been how complex health system can be, but also how many opportunities there are, how many untapped opportunities there are to really engage with that process and make a contribution and get patients a lot more involved within this area.
I have the feeling that over the last 5 years, in terms of my understanding of healthcare systems, of my condition, and of opportunities for patients, of whom I am one, to influence and improve those, a lot of the things that I've been doing with the Hilfe over the last 5 years are slotting into context. I understand now much more of the things that I've already been trying to do for 5 years. And so, to a great extent, actually, becoming a EUPATI Fellow, assuming I manage it this week, will equip me in ways that I have felt under-equipped in the last 5 years. I contribute already to a national program of quality control for hospitals and other centres that do neurosurgery in Germany. I am one of the first generation of lay members of the Ethics Commission at the University of Freiburg, which is an immense privilege, a very difficult job. Finally, I feel like I have a bit of paper that says, yes, you're qualified to be it. So I don't, in a way I'm not looking forward, in a way I'm looking more backward and saying, well, thank goodness, now I've actually got some principles, some vocabulary, some structure within which I can carry out the work that I've increasingly been doing already for the last 5 years.
With Croatia's association in Croatia Association of Epilepsy Disease, have a EUPATI national platform, and of course in my work, I work like a nurse.
My plan after this is to really be able to find more ways to encourage patient engagement in Australia, and part of that's going to be reaching out to our Therapeutic Goods Authority and finding out what existing pathways there are, but also what areas may need to be improved to really advocate for that patient involvement in Australia.
I would. I come from a country, I was born and brought up in the UK, where healthcare is pretty much nationally free of charge at the point of delivery to the patient, which I found unbelievably good, even at the time I lived there. I've since come to Germany, where healthcare is surprisingly hierarchical. The doctor, the hospital surgeon, is known as the god in a white coat. It's a very top-down process in many instances. Many of the individual healthcare workers see that as wrong, as susceptible to change, but they don't really know what the structures might look like that will replace it. And if I can contribute to a modernization and a flexibilization of healthcare structures in Germany, I will be enormously grateful, and so will millions of Germans.
Absolutely.
And why?
Because of people, because your knowledge, because you are connected with other institutions, because of everything. It's beautiful to know everything and to hear some.
I really recommend this program to anybody that's interested, particularly people involved in patient support organisations, because it really does give you the tools, the confidence to really get out there and make a difference, and it gives you those connections as well with people that can help you along your journey.